So far, we are doing really well getting them back.
Every day at 9:30 and 4.
Those of you on the line that are managers or leaders.
Leaders at East Tennessee Children's Hospital work to guide staff and patients through the COVID-19 pandemic.
Huge saver for us.
The Incident Command Center decides how the hospital will react to a crisis that's affected every operation in the hospital.
You really need to make rounds with your staffs today and tell them we really appreciate it.
Chief Nursing Officer Ron Phillips is this week's incident commander. He leads the meetings.
One of the things that we are striving for is how much can we give you quickly that's accurate and factual, and trying to eliminate all the fake news or the unsure stories, all those things that give us a lot of angst.
It starts with a large conference call.
They started that yesterday.
Where Phillips, or whoever's the incident commander for the day, gives a brief overview of the status of the hospital to managers. That includes how many COVID-19 tests doctors have sent and those test results.
We had HICS training, which is just the structure. The government tells you how you want this ran, so we're all doing it the same way. Every hospital in town is doing the exact same thing we are, every hospital in the region.
Phillips says because of that structure, hospitals in town and across the nation can learn from each other. That way, Children's Hospital can avoid mistakes while handling the pandemic, like what we saw in China or in Seattle. That includes conserving personal protective equipment, or PPE.
So we're learning from what other people have done, both good and bad, where they made mistakes, where they've done well at. And we're actually a little bit ahead of the curve as far as usage of PPE. We were informed in January early, that there could be potentially problems.
Children's Hospital is part of a coordinated effort between hospitals, the CDC, and the Knox County Health Department to make sure patients are taken care of. Through leadership at Incident Command, food services like the cafeteria and Clayton Cafe are having customers stand on X's that are 6 feet apart. Hand sanitizer is more important than ever with stations across the hospital, and Children's Hospital bought more web cameras and expanded video conferencing software so departments can meet online and help patients through telehealth. Phillips says the leaders in the ICC aren't the main fighters in this battle with COVID-19. Staff and patients are.
If you've heard the phone calls, the way that I close that phone call off, is there any issues, problems, or concerns? There's 15 or 20 people on the phone call, as well as the 5 or 6 of us in that room. We're hearing bits and pieces of things that we might not have thought of, or issues that are just a little bit different than what we anticipated.
That listening ear helps Children's Hospital face challenges like COVID-19 successfully. Phillips says he's proud of the dedicated staff for handling the pandemic. He says Children's Hospital stands out because it delivers a special level of care, especially in times like these.
We had a mother come in. Child's birthday was yesterday. She couldn't leave the building, didn't have anything for her birthday. Because the gift shop was there, we were able to help her. We look at the family as a whole. We can't just think about just the patient. The adult hospitals have tightened up their visiting that they have no visitors at all. We're still trying to maintain as much of a sense of normalcy as we possibly can, and that's hard in this environment.